Keep us covered. Hands off Medicare. Keep us covered. Hands off Medicare. Keep us covered.
Nurses of Massachusetts are outraged by the Massachusetts Hospital Association's callous decision to lobby for a raise in Medicare eligibility and a move that could result in millions of our most vulnerable seniors losing access to their health care. They have given throughout their entire lives, working and paying for a retirement health care benefit that was promised to them and that they rightly deserve. Under the current system in place, nurses already see seniors struggling to access the care they need. The cost of prescription drugs and the rising costs associated with our basic needs is already causing many seniors to delay care and treatment, or is also hampering their ability to manage chronic health conditions, which is resulting in delays in care, substandard care, or more expensive care delivered in our emergency rooms. And when patients receive care, they are often receiving substandard care, as hospitals has refused to provide the staff and resources needed to keep our seniors safe. More than 2,000 patients a year die in Massachusetts hospitals, and most of them are seniors. Healthcare is already the leading cause of bankruptcy in this country, and our state is cutting services and closing programs because of the budgetary demands of the most recent healthcare initiatives. Health policy experts state that raising Medicare eligibility will only make matters worse, increasing the cost of care borne by the state, dramatically reducing seniors' access to care, and forcing them to bear even higher out-of-the-pocket costs. And now we have the MHA complaining that they, in their words of their executive director, give and give and give. In plain English, shame, shame, shame. While some hospitals are indeed suffering financial distress, the fact is the hospital industry in Massachusetts has posted and continues to post multi-million-dollar profits. The operating budget for one network alone has been reported to be greater than the World Health Organization. Let me repeat that. The operating budget for one network alone has been reported to be greater than that of the World Health Organization. And now we have a for-profit provider, which is owned by a mammoth private equity firm with several billions of dollars in assets, gobbling up our hospitals. If you want to know why this city and this country is being occupied and is ringing with the sound of outraged voices of protest, this is why. The greed of MHA, like the greed we exhibited by the corporate giants on Wall Street, now knows the bounds. The distribution of wealth and power has left the playing field unequal for our seniors and for the citizens of Massachusetts. It is time that we all stand up for our seniors and our people on Main Street who are asking to be paid the price of corporate greed and neglect. We nurses are joining these seniors and other advocates today to say to MHA and to the policymakers whom they are lobbying, no. You cannot and must not abandon our commitment to care for the senior citizens of this country. You cannot and must not sell out all those who built this great nation to benefit those who stand to profit from their suffering.
Keep seniors covered. Hands off Medicare. Keep seniors covered. Hands